Hi, my name is Konika Planis and you're watching a video on the management of dissociated vertical deviation. Whilst we're discussing infantile esotropia, it would be remiss not to discuss the management of DVD. As you're aware, DVD is an associated clinical feature of infantile esotropia, and some patients will need the DVD managed. When does DVD need to be managed? The only time we consider treating DVD is if it occurs spontaneously. What this means is that it's becoming manifest. Now, as you're aware, DVD is a latent type of deviation. It occurs under the cover as the illumination reduces. So it's not an issue when it's only occurring upon dissociation or when we reduce illumination. However, it is an issue if it becomes manifest, which means that both eyes open, the eye starts to drift up. At this point, you have a cosmetic issue that needs to be dealt with. Now, the primary treatment for DVD is surgery. It is suggested that if there's a refractive error, you deal with that refractive error as it can assist. However, if the DVD continues to spontaneously manifest, then surgery will be your only option. In terms of what surgery do we perform, over to the right, I have a flow chart for considering what we need to do in terms of managing a patient with DVD. So we have a patient diagnosed with DVD, and either the DVD is frequently manifest or it's infrequently manifest, or it may not be manifest at all. In this instance, where it's infrequently or not becoming manifest, then no surgery is required. However, if we have a frequently manifest DVD and we have a cosmetic issue, then the patient requires surgery. The next consideration is whether we have an inferior oblique overaction with the DVD or whether we have DVD alone present. Where there's DVD alone present, we can perform a superior rectus recession, and where there is an inferior oblique in addition to the DVD, we can perform an inferior oblique anteriorization. An anteriorization means that the inferior oblique is transposed or moved anteriorly. Now, whilst I've listed these here as preferred options, you will see in your reading that there are alternatives. For instance, you can do a Farden on the superior rectus, or you can do a superior rectus recession with a Farden. Or you can even perform an inferior oblique anteriorization in a patient who only has DVD with no inferior oblique overaction. So there are variations to this flowchart, but two of the main procedures we consider is that superior rectus recession and inferior oblique anteriorization. Now, one other thing to consider is that DVD is a bilateral condition. So even when you see significant asymmetry, or even in some instances where you see unilateral DVD, so you can't actually observe bilateral DVD in clinic, it is suggested that bilateral surgery is considered. Studies have shown that when you only operate on one eye, the DVD in the other eye will increase or will be elicited if you didn't see it preoperatively. So always consider bilateral surgery when managing a patient with DVD. Okay, that brings us to the conclusion of this video. Thank you for watching.